Why I'm losing hair. Hi everyone, if you have ever noticed clumps of hair in your shower drain, strains on your pillow or thinning on the crown and thought that why it is happening with me, you are not alone. Hair fall is one of the most common concern, which is most confusing health concern worldwide. Today I'm going to break it down, the different types of hair fall and why they happen and what they might be saying about your body. In fact, losing 50 to 100 hairs per day is completely normal. There are three life cycles for the hair: anagen, which is a growth phase, catagen, which is a transition phase, and telogen, which is the resting shedding phase. But when you start noticing more than usual shedding or bald patches, widening or visible scalps, that's when it's time to dig deeper, because hair is not just cosmetic, it's a mirror of your internal health, from your hormones to immunity to your nutrition. Let's decode the main types of hair loss and what causes each. Number one is telogen effluvium, sudden diffuse shedding. What it looks like: sudden thinning all over the scalp. Why it happens? Physical or emotional stress, postpartum changes, crash diet, fever, surgery or COVID. Certain medications, think of it as a body hitting the panic button. Hair enters the resting phase and the fallout in handfuls, which is 2 to 3 months after the trigger. The good news that it usually grows back with time. Second is androgenetic alopecia, which is hormonal or pattern hair loss. What it looks like: reducing the hairline, thinning crown in men, widening apart in women. This is a most common and progressive type of hair loss. In women, it often worsens with PCOS, perimenopause or hormonal imbalance. Treatment options can be DHT blockers, hormonal balancing, nutritional support, scalp stimulation therapies. Now the third is alopecia areata. It's an autoimmune hair loss. What it looks like: round bald patches, sometimes with complete scalp or body hair loss. Why it happens? Your immune system mistakenly attacks your own hair follicles, triggered by stress, infection or immune dysregulations. This is unpredictable, sometimes irreversible as well, sometimes chronic. Support often includes reducing inflammation, treating gut health, stress management. Now fourth kind of hair loss is the traction alopecia, hair styling damage. What it looks like: hair loss along the hairline or sides. Why it happens? Tight ponytails, braids, hair extensions, repeatedly pulling over time. The solution: change your hairstyle and give your scalp a break. In early stages, this is reversible. If prolonged, it may cause permanent follicle damage. The fifth is nutrition deficiency related to hair loss. What it looks like: diffuse thinning or breakage. Why it happens? Lack of key ingredients like iron, vitamin D, zinc, vitamin Bs, protein. Your hair is not essential for survival, so when nutrients run low, your body prioritizes organs over your hair. Fix the root, test your levels, improve your diet or supplement where it is needed. What hair fall might be telling you? Now let's talk about that. Hair loss is often a symptom, not a diagnosis. It may be your body's way of saying something. I am under too much stress. I am not getting enough nutrients. My hormones are out of balance. My immune system is overreacting. Instead of just using hair oils or switching shampoos, it's important to look inside, not just the outside. Here is what I recommend. Identify your pattern of hair loss. Get blood tests done if needed. Iron, vitamin D, thyroid hormones. Reduce stress and improve sleep. Add scalp massage and gentle care.